I'm Emilie, one of the radiologists working at Vets. I'm going to show you here how to diagnose a mechanical obstruction on ultrasound. Ultrasound has a reported perfect sensitivity and almost perfect specificity. When you want to assess for a non-linear foreign body, which could be a textile foreign body or a bone or something else, you want to look for a hyperechoic interface associated with a strong acoustic, distal acoustic shadowing, which can have variable intensity. Proximal to that, you want to see if there's any fluid dilation proximal to the foreign body, and that would allow you to suspect that there is a mechanical obstruction due to the presence of the foreign body. When you've got a linear foreign body, you've got typically a persistent echogenic or hyperechoic linear structure in the center of the intestinal lumen. This is associated with intestinal plication. That's what we see on the first image on the left-hand side. In some cases, the linear foreign body actually extends out of the small intestine, and that's when you've got laceration of the wall. So you might have this foreign body floating into the mesentery and surrounded by hypoechoic reaction. When you've got an interception, you've got a series of multi-layered concentric rings. Typically, the intercepted loop has a little bit of fat due to the presence of mesentery. You can also have interception with the mesenteric lymph nodes. Proximal to that interception, you will have fluid dilation of the small intestine and increased peristalsis without signs of content progression. And when you've got a neoplastic process causing the mechanical obstruction, you typically have an increased wall thickness with loss of the wall layering. The adjacent mesentery is typically hyperechoic. And on this image, you've got a cross-section of a small intestinal loop where all the normal texture of the wall has gone. And on the image on the right-hand side, that's a longitudinal view of that same loop where on the left side you've got a small intestine not dilated, and on the right side you've got a marked dilation with fluid content. So you definitely have a mechanical obstruction here. And when you compare ultrasound to X-ray, ultrasound is always better at determining the presence of the foreign body, the presence of small intestinal dilation and plication. And ultrasound is also better at detecting free fluid, small intestinal wall changes, and even small intestinal perforation, where sometimes no pneumoperitoneum is detected on radiographs. In the next video, we're going to come back to this case that Chris presented and see how we can perform the surgery.